A 65-year-old woman has had a DEXA scan after she had a wrist fracture following a minor fall. The results are as follows. Lumbar spine, the T-score is -2. For her femoral neck, the T-score is -2.5. In terms of her femoral neck bone density, what is the meaning of this score? A. Her bone density is 2.5 standard deviations below that of an average 65-year-old woman. B. Her bone density is 2.5 standard deviations below that of an average healthy young adult. C. Her bone density is 2.5 standard deviations below that of an average premenopausal woman. D. Her bone density is 2.5% below that of an average 65-year-old woman. E. Her trabecular bone score is 2.5 standard deviations below that of an average healthy young adult. I'll give you 30 seconds to read and decide your answer. Feel free to pause the webinar if you need longer. The answer to question 4 is B. Her bone density is 2.5 standard deviations below that of an average healthy young adult. T-scores describe one's bone density as a standard deviation score in comparison to the mean value derived from a reference population of young healthy adults, usually 30 years old, as this is the age of peak bone mass attainment. The units are therefore expressed as standard deviations above or below the mean of this young reference point. The patient's femoral neck bone density is therefore 2.5 standard deviations below that of an average healthy young adult. We'll now be looking at osteoporosis in more detail. Osteoporosis is a disease characterized by low bone mass and structural deterioration of bone tissue. This has a consequent increase in bone fragility and makes patients susceptible to fractures. Osteoporosis itself is asymptomatic and often remains undiagnosed until a fragility fracture occurs. Risk factors for osteoporosis include female sex, increasing age, menopause, oral corticosteroids, smoking, alcohol, previous fragility fractures, rheumatological conditions such as rheumatoid arthritis, a parental history of hip fractures, and a BMI of less than 18.5. The World Health Organization provides definitions based on the T-score of the femoral neck, and this is based on the DEXA scan results. The T-score is the number of standard deviations the patient is from an average healthy young adult. A T-score of -1 means the bone mineral density is 1 standard deviation below the average for healthy young adults. From the table, you can see the definitions for this. So normal T-score is defined as more than -1. Osteopenia is defined as -1 to -2.5. Osteoporosis is defined as a T-score at the hip of less than -2.5. And severe osteoporosis is defined as a T-score at the hip of less than -2.5 plus a fracture. The 10-year risk of a major osteoporotic fracture and a hip fracture can be calculated using either the Q fracture tool, this is first line suggested by NICE, or the FRAX tool. However, NICE says this may underestimate the risk in some patients. Patients are categorized as low, intermediate, or high risk based on the risk factor. For Q fracture, this is based on the percentage and patients above 10% are considered for a DEXA scan. For FRAX, this is based on the NOG guideline chart, which advises whether to arrange a DEXA scan or start treatment. A DEXA may be arranged without calculating the risk in patients over 50 with a fragility fracture. Treatment may be started without a DEXA in patients with a vertebral fracture. Management of osteoporosis. The first step is to address the reversible risk factors. For example, increase physical activity, maintain a healthy weight, stop smoking, and reduce alcohol consumption. The second step is to address insufficient intake of calcium and inadequate vitamin D. Bisphosphonates are the first-line treatment for osteoporosis. They are recommended for patients with osteoporosis based on a DEXA scan. They are also considered in patients on long-term steroids. They work by interfering with the way osteoclasts attach to the bone, reducing their activity and the reabsorption of bone. They do have important side effects that patients need to be counselled on, such as reflux, atypical fractures, osteonecrosis of the jaw, so regular dental checkups are recommended, and osteonecrosis of the external auditory canal. Hormone replacement therapy can be considered in younger postmenopausal women to reduce their risk of osteoporotic fractures. Follow-up should be arranged to assess and manage the adverse effects of bone-sparing treatment, adherence to treatment, and the need for continuing the treatment with bisphosphonates after 5 years.